and it's a real pleasure for me to be here with all of you today. Thanks APCOM for inviting us and providing us this space for this session today. So as it was already mentioned, the session is focused on expanding access to oral injectable PrEP in Asia and the Pacific. We have learned this morning that to accelerate PrEP scale-up in our region, 4 elements need to work together: policy reform, affordable and sustainable access, community-led service delivery models, and a strong human rights and equity lens so no one is left behind. We will hear concrete examples of how these pieces come together during our session. We will learn from the regional level, from a local government championing PrEP, and from a community-led organization driving uptake on the ground. So let me start by inviting and call on the stage our speakers. Let me start with Tung, Executive Director of the Lighthouse Enterprise. Welcome to you. Tung is a pioneer in community-led PrEP delivery and stigma-free services in Vietnam. Welcome, Tung. Next is Dr. Rolando Cruz, Head of the Epidemiology and Surveillance Unit, Quezon City, Philippines.
Go Philippines!
Leading PrEP interrogation at the city levels. Welcome, Dr. Cruz. From the development partner side, let me welcome Leslie Ong, Program Specialist, UNDP Bangkok Regional Hub, who works on accelerated regulatory pathways and access to new medicine. Welcome, Leslie. And Dr. Kim Cho Wing Hin, Regional Prevention, HIV Prevention and Treatment Advisor, UNAIDS Asia and the Pacific, who provides technical assistance to countries on policy reform and scale-up of oral and injectable PrEP across the region. A big round of applause to our speakers. We will ask our speaker a few questions, and then I would like to open the floor for our audience so we can also hear your reflection and your bold ideas, because PrEP access is real when communities lead. Let me start with my colleague Kincho. Kincho, your presentation was really great and comprehensive this morning. And the regional data shows that we are really far from our PrEP targets. I would like to hear from you, what are the most critical policy shifts that governments need to make to expand equitable and sustainable access to oral and injectable PrEP? Thank you.
Thank you, Michaela. Actually, I'm looking for Naomi because she told me that I'm talking too long. So let me start again the mantra of giving options and choices. As I mentioned in my presentation, giving options and choices, including for prevention, is the basic health right. Building on that, what I would say is the policy shifts that needs to happen must be grounded in that right-based approach, that everyone is entitled to have prevention options and choices. And along that line, we have to normalize PrEP, not only oral, including the injectables. And we hear from 3 previous speakers about very encouraging development in terms of how national policies and guidelines are inclusive. For example, in Thailand, Dr. Nitya presented that they are going to launch the new guidelines that includes all PrEP options. And what is also very impressive is about the different service delivery models of the pharmacy-led, community-led. This is very important in terms of when we are thinking about the policy shifts. And basically, Thailand, Vietnam, Cambodia, they are leading the way in PrEP provision in our region because of that kind of the policy approaches that is really embrace the community engagement, like Dr. Bora mentioned, that how they value the community-led participation, how community has designed, and also we can see from Vietnam how diverse options of PrEP are provided through the Delhi bus, all these spectrums of amazing service delivery options. So in all these policies and guidelines, we have to clearly making sure that not just the options, but also that demedicalized approaches, differentiated service delivery models, that needs to be clearly reflected in the guidelines. And it is also prime for the future innovation like MK8527, that is oral PrEP, monthly oral PrEP, so that we don't have to repeatedly wait for the guidelines and approval that needs to happen. And my friend Keaton raised the interesting question about the prevention and treatment. And I think that is also one of the policy dialogue and approaches, that prevention is equally as important as treatment. We know that, for example, DTG, the dolutegravir-based ARV regimens that are actually recommended by WHO, maybe in 2018 and 19, but around that. I'm not saying that we are doing perfect or we are ahead of the curve in terms of transition to that DTG-based regimen. But when you look at the data information from countries, many of the countries already adopted DTG-based regimen as the first line. The number and volume is another thing, but at least from the policy and guideline wise, the governments are very quick in adopting WHO guidelines on treatment. But PrEP, the first guideline was out in 2012. We are in 2025, 13 years after, and look at the number of PrEP numbers, 98% gap. So this is one point I would like to emphasize, that all the policymakers, government, all the decision makers, prevention is equally important as treatment. And then another point is that we would like to walk away, because actually I already touched upon in my presentation as well, we would like to walk away from the small scale projects or demonstration studies. We have enough evidence. We introduced PrEP from the WHO guidelines since 2012, and this is that era to move away from the 100 people here with the pilot, 200 people with demonstration project over there. So this is something we totally need to shift from that. And for example, Cambodia, they started PrEP only in 2019. So in terms of introducing PrEP, they are quite late, but they can do it very quickly and scaling up very quickly in a country with a population of 16 million. I think, if I'm not mistaken, more than 40,000 people are on PrEP, because they skip the pilot. They do the phase implementation. So this is one of the evidence that we can see from Cambodia as well. And in terms of policy, I would like to emphasize on two things. One is the age of consent. Many countries, they started the age of consent for testing and various prevention options, age of 18, which is way too late. We know from the data information, everything, that as early as 13 to 14 years of age, people start engaging in the risk behavior. So we need to also make sure that we have to break down the barriers on the age of consent. And another one is very medicalized approaches. I will emphasize once more again that we need to go for the demedicalized services. I'll stop now.
Thank you, Kincho, for your insight. And now I would like to move from the policy shifts to the programmatic level. What program approaches work best to reach the people who face the most barriers? So basically for the programmatic aspect, I would like to focus more on the accessibility to the services. So, like I mentioned in the previous question, that we need to design for scale since the beginning, not just start with a small scale. We may not be able to do as a large scale or national scale up at once, but we need to start from the realistic approach with the phase implementation. And I can see from various presentations and other dialogues happening with the Global Fund that, for example, land will be provided by Global Fund in certain number of countries in our region. So we have to seize that opportunity. We have to start to learn to how to do the phase implementation, how to do the startup, how to expand it in a very efficient and effective manner
to make sure that it is not just within the period of global fund or PEPFAR will provide 2,000 doses or 3,000 doses. We need to plan beyond that in the programmatic approach. And also that comes with the advocacy dialogues, like Dr. Nidya and Keaton mentioned about need to talk with the Prime Minister, National Health Statistical Office, and for some countries, for example, Ministry of Finance and etc. So we have to start doing that advocacy now, and we need to instill the sustainable thinking, because we cannot stop after that 6,000 doses gone, then how do we do it? So we can't stop the services. We suffered enough from the service disruptions within this year, and this is a great lesson learned for us that the international support should be for something that we can leapfrog on it, but not for our reliance factor. And speaking of advocacy and policy shifts, from the programmatic implementation point of view, I understand that policy shift and the advocacy efforts will take months or even years, and policy change may not happen maybe within 4 or 5 years. We understand that. But do we need to wait for that policy shift to happen at the program implementation level? We cannot. I don't want to put you on the spot like Eds for Malaysia, because for example, PrEP provision in Malaysia is actually within the government facility. So there are the conditions, the rules and regulation that it cannot be provided outside of the government facilities. But they have like walk-around solution, that innovations that they have the PrEP navigators from the community linking with the government services so that they have the trust. And then the confidence to go to the government services. And then the PrEP navigator take that through to all the journey, from the referral, adherence and everything. So even the policy shift does not happen overnight. At the programmatic level, we need to be very innovative. Like also Dr. Nidya mentioned that, okay, we have to ignore for a while, that just continue with the community services, right? And then at the service provision level, I couldn't just emphasize, I will keep saying that the role of the community, right? Implementation, design, and also the feedback to improve the services. That is of great importance as well. And one of the lessons that we learned from oral PrEP is the demand generation is not great enough. So we really need to learn and pick up from the lessons that we have from the oral PrEP to make sure that when we have so many options currently available and there are also options in the pipeline, we learn from that lessons what can improve at the programmatic level as well. And also I really like the presentation from Vietnam, how the services are also provided at the private facilities. That is also one of the options that maybe some of the people, they would like to access at the private sector. For example, in Thailand, in Gambali, some are even buying at almost $500 per month. So we need to make sure that there are options at the private sector as well, but at the same time we need better collaboration for the services at the private sector. And then last point that I would like to touch upon is the data. Because from the various presentations we can see that how many people are on PrEP, and then PrEP new, PrEP cumulative, etc., which is great to see. Because at least we have the numbers. We know how many are on PrEP, how many are cumulative, etc. And actually, UN ourselves just collected the information on, for example, number of people on PrEP in the last 12 months, disaggregated by PrEP options and the population and age. But we need to go beyond that. The data needs to really inform back to the program implementation. Like the question that Harry asked, why there is the huge dropout, why there is no proper adherence. So there is very limited information at the program level to really understand why they stop. Some people, they stop PrEP because they perceive that they're no longer at risk or they are not really at risk. But there are several other reasons that we need to understand to improve our program strategy and program approaches. But this is almost lacking in most of the countries, I would say. The programmatic level information that is not only collected, that also used and feedback to the program manager, to the donors, to the government to improve the services. So,
Thank you.
now is when.
Thank you, Kincho, for these great insights from the policy change that is required to the programmatic implementation, and also touching upon the importance of collaboration coming from different sectors, and also the importance of government commitment. And we heard from different government representatives this morning. And I would like then to invite Dr. Cruz from Quezon City Health Department to talk a bit more about government commitment at the local level and how this is turning PrEP into reality. And specifically, I would like to ask what practical innovation helped you expand access to PrEP in Quezon City? Thank you.
Thank you. Thank you for APCOM for the invitation and commitment. And thank you, Mom, for your question. So, really, for Quezon City, there's not much secret on what we are doing. So, the Quezon City government advocates for good governance, for open government. I think this sounds corny, but actually it's really something that we must be advocate on. Because if you have a government or local government who actually advocate for good governance, no? So you have enough money for health. No? So if you have actually your political leadership demands evidence, no? in doing programs, you actually much easier time for you to advocate for a certain program, just like PrEP. So in 2019, we have a very robust local ordinance on HIV. This includes a combination prevention, which includes PrEP already. So there's so much discussion on how we're going to provide this, but at the end of the day, evidence prevails. So this was approved in 2019. And you can see the evidence by at a yearly basis, the number of, the total investment for HIV actually grew, no, from near 3 million before 2019 to 30 million in this year. No? And in 2026, we have the same amount of investment for HIV in Quezon City. So really, for technical person like me, who are about evidence-based HIV intervention like PrEP, it's not really that difficult. So you have really a policy that backs your intervention. You have already the structure that we're going to be point service delivery points for this intervention. And then the ordinance, the local ordinance, you encourage community participation, community partnership. So when we are back in 2019, when before the pandemic, we are actually discussing how Quezon City can move out of the global response already. But of course, the pandemic happened, so it was delayed. So back then, we are already discussing, every global fund rounds, and there's this discussion on how to sustain these. So we took that quite seriously in Quezon City. That's why investments are growing. So at this time, the PrEP initiative right now in Quezon City is really, we are just waiting for the national guidelines. There is money to buy PrEP. There is money to expand PrEP. And the only question is how. No? So how are we going to do this? It's easy to buy, easy to put money into this, but how are we going to give this to the people who needs it is a different thing.
Yeah.
So that's what we are doing right now. There's a lot of discussion. We have partnership with community-based organization right now who are actually, we want to understand how they distribute PrEP at this time so that how we can help in expanding that in the near future when we can start buying governments actually allowed to buy PrEP right now. So really, good governance is a number one priority. So if your local government unit or your leadership will say that you don't have money for health, I think you should doubt that already. So you should not elect that already in your next election or something. So really, because it's really a good, it's really not so difficult for technical people when you have leadership, political leadership who understand evidence, who understand that the community is their priority.
Thank you, Dr. Cruz. Excellent work done in Kansas City, and thank you so much for mentioning that the role of communities is critical now at this point, that PrEP implementation will start, PrEP will be distributed, so this is where the community really play a critical role to reach more those that are most in need. So along this line, I would like to ask, how are you collaborating, or are you planning to collaborate with community-led organizations and networks, and how can this collaboration be sustained long-term, for example, through social contracting?
Before, social contracting was a buzzword for the sustainability of the global fund. We're already hiring people that are part of the community to be part of our local response. So now, of course, there are limitations. They now become government employees. So there's now become limitations to that. No? So now we're discussing how we can actually support a community-based organization. For example, HASH. Now, HASH is a very good partner of Quezon City, a long-time partner of Quezon City, who are actually distributing PrEP right now and other HIV testing activities. So how can we support that? So there's a lot of discussion on that. In the last Global Fund discussion on sustainability, again, they're talking because Global Fund will end. They're now discussing about this already. So there's a long line, a long timeline on how a community-led or social contracting can be done in the Philippines. So I think we should start talking about how the government really understand what is community-led, and how the community-based organization understand how the government works. No? Its procurement process, its laws, etc. No? So because it's different when you have a global fund support, that you can actually, it's different from point of view of a global fund support activities to a government support activities. The levels of the ceiling for payment for everything, the services, are quite different, no? From the point of government. No? So we should start discussing that so that everyone understand at the level of playing field understand. Because sometimes if I put 10 million pesos, for example, for a government-led, community-led intervention, but nobody will qualify for that. It's going to be a wasted investment on my part, and it's not good. It will not reflect good in my program. So I think there's still a long discussion on how we can do this in the Philippines, but we are open to that because we have the money. We have the money actually. So it's just we can support. We are doing this in other programs. Yeah. But how can we do this in government and in HIV so that this can be executed well? So at this time, we are in support of community-led interventions in HIV.
Thank you, Dr. Cruz. I think it's really great because you are showing how political will at the local level plus community partnership can really lead to real PrEP access. And now I would like to shift to a different focus, regulatory pathways and how we can accelerate access to generic PrEP. And I would like to turn to Leslie from UNDP. UNDP has supported many countries to make PrEP more affordable by accelerating regulatory approvals and strengthening procurement pathways. I would like to ask you what regulatory or regional strategies can speed up access to both oral and injectable PrEP, especially in countries with limited domestic procurement or manufacturing capacity. And I would like to ask my colleague Newman if we can put up the slide for this. Thank you.
Okay.
Thank you.
Thanks, Michaela.
Over to you, Leslie.
I'd just like to start by apologizing because out of all of you in this room, I'm probably the least knowledgeable about PrEP. Yeah, do take my interventions with that in mind. But you might be wondering, why am I on stage in that case? I am part of a, hello? Yeah, I'm part of a UNDP-led initiative that works with countries in promoting access and delivery of new health technologies. So whether they're medicines, vaccines, diagnostics, and this relates to what I've got up there as well. Not meaning to go through this in great detail, but just to kind of give you a sense of the typical kind of life cycle of a new medicine, whether that's a generic or whether it's an originator drug. And I think most of you already kind of are familiar with this. But really, if you have a new medicine that has been WHO pre-qualified, it's recommended by WHO, then how do you then get it into the countries, and how do you get it to the communities, right? So, through three phases primarily. It is preparing the country to begin with on introducing that product. What is the delivery preparedness of the country is important, and that includes working with the communities and ensuring that they have awareness of the new product that's coming out. And what it is that you need to do to grow the demand and grow the trust, right? And by the way, listening to one of the presentations earlier, I also realized what a rich pipeline of PrEP products that are coming down the R&D pipeline. So, this value chain or life cycle, whatever you want to call it, is absolutely critical in terms of your consideration as a in terms of advocating the governments, in terms of advocating the suppliers, etc., in introducing these new products. So anyway, moving to phase 2 in terms of piloting, and it's not the demonstration projects that Coach Yin mentioned before. It is about optimizing the delivery strategies, right, based on local context, right. Real-life local context. So it is ensuring that these products are getting to communities that need them in the most efficient and effective way. And then phase 3, it is about scaling up. It is about strengthening health system capacities to be able to expand the program nationally. And that may also then include, as someone has already mentioned, integration into existing national frameworks, like National Essential Medicines List and STGs, etc. So, just to kind of answer your question around the regulatory barriers and what it is that we can do from the regulatory point of view to speed up access. Now, what actually are the barriers to regulatory barriers to access? Now, this is where I then draw your attention to the bubble in red. There are capacities and functions that we need to consider and we need to effectively implement that can help us shape the market and strengthen the enabling ecosystem for access and delivery, right? So without, and I'll touch on a couple of those during my intervention, without these functions or capacities, a lot of what you see in the 3 phases cannot easily be implemented, right? And I'll start with marketing authorization. So, as you know, for a product to be made available at the country level, or be legally able to distribute a product, it needs to go through a regulatory review process for efficacy and quality and safety. And that could be a very lengthy and complex process. And that's where I think you will actually see how the regulatory system in some countries, in many countries, can play a really a big barrier to access, particularly in the lower middle income countries. These countries, a lot of these countries experience what you call a regulatory lag or a drug lag, where you can even it can be up to a number of years after the product is first approved by a high income country before you see the approval in a lower income country. So what contributes to this regulatory lag? It is a complex process. Some countries may not have the capacity or in fact, the right regulatory framework to be able to conduct this process effectively. Some national regulatory authorities are non-autonomous, so which means that they're not very well resourced or financed to be able to do this, and also infrastructure like laboratory systems to be able to conduct bioequivalence testing, for example, doesn't exist, and it could be expensive to rely on labs overseas. There is a fragmentation of regulatory systems across the region, particularly in the Asia-Pacific region. I'll get to that in a minute. Which means that every single country has their own distinct legal frameworks, distinct processes for reviewing a product, and also the process to actually submit the product dossier could also be different from country to country. So that creates a lot of inefficiencies and duplication of the work, and in a way also then leads to a delay in the application from the supplier into a market. So how do we address this? Well, I mean, there are a number of ways to do this, but one of which I want to emphasize is I think we need to do better in terms of leveraging the existing global and regional regulatory platforms that promote regulatory harmonization as well as regulatory reliance. Now, the WHO's collaborative registration procedure is one example of that, and I'm not sure that we have WHO colleagues in the room, but essentially this is a global platform that I think almost 100 countries around the world has signed up to, where they facilitate regulatory alliance from one country to the other, meaning a country with possibly a regulatory authority that is not able to perform its own regulatory review can rely on the regulatory review performed by another country so that it can then base its decision-making and expedite its decision-making based on that other country's review process. Another example in the Asia-Pacific region is the ASEAN Joint Assessment Joint Assessment Coordination Group. And I believe this group was actually used in recent years to review cabotegravir, thank you, for a few of the countries in the region. And so this particular platform actually promotes work sharing, they call it, right? So a national authority with possibly a lower maturity level work closely side by side with a regulatory authority with a higher maturity level. And I think for CAPO, I think it was the Australian NRA that was involved in that review process. And at the same time, these regulatory authorities would then review and approve a product together, and at the same time also then build the capacity of the authority with lower maturity. And then finally, there is also the Southeast Asian Regulatory Network, which can be leveraged to also promote standardization of regulatory guidelines as well as regulatory processes across the region. And this could be in the form of the development of model laws and regulations, and also in terms of driving the domestication of a lot of these model laws and regulations at the country level. I'll stop there for now. Thank you.
Thank you, Les, for sharing regulatory and regional strategies that can speed up access to PrEP. You mentioned leveraging global and regional regulatory frameworks and platform and guidelines, and you gave a few examples from the region. Now I would like to move to the financing aspect. So what financing approaches could help keep PrEP affordable and sustainable, particularly as external funding are decreasing? Thank you.
Yeah, thanks. I'm hoping that they will leave the chart up there because it does touch on the other another point on the market shaping aspect of access and delivery. Now, the question touches on the issues around affordability, around reliability of supply, and also timely access, right? And just like regulatory approval process, the regulatory pathway of new products, it does rely on better cooperation and coordination between countries. And I'm going to really emphasize this opportunity that we have in this region around pool procurement of new medicines, particularly medicines that are expensive, as we've heard for some of the newer PrEPs, but also medicines that may actually struggle in terms of ensuring availability and supply to a particular market. By the way, I'm speaking from the perspective of public procurement, and as I understand from the presentations earlier, a lot of the newer PrEP is accessed through out-of-pocket payments through the private sector. But I just want to say that even through the lens of public procurement, we can apply these strategies to drive down prices for private sector expenditure for PrEP, right? Particularly when I heard earlier that there is the intention of really advocating for the inclusion of the newer PrEP into the UHC programs and be listed on reimbursement lists and all that. So I think so pool procurement is important on that front as well. So why do we want to do pool procurement? Well, firstly, I think this is quite obvious. If you're pooling the demand, pooling the resources and financing, then you have a much bigger purchasing power. And this economies of scale will then allow us to negotiate a much lower price for a new product, as well as negotiate a much more favorable supply agreement with the supplier. And certainly, with some of the countries in this region, if you have a smaller market or if you don't have a local manufacturing capacity, this is actually a very important mechanism that you can exploit and leverage. And then on the supply side, pool procurement also reduces the fragmentation of the market across the region. So, if you are able to provide a predictable and stable market for the supplier, then it really de-risks the investment that they need to put in to introduce a new product into a market. So this market assurance really is a really strong kind of pull incentive for suppliers of new products. And that also includes the incentive for them to register early into a market, as well as ensure that there is continued supply of that product into the market. So how do we do this? How do we promote pool procurement? Well, essentially it is about establishing a regional mechanism that we can pool the financing and coordinate and conduct the pool procurement. And in other regions like the African Union, in PAHO, and in among some countries in Europe as well, a lot of these mechanisms have already been implemented for quite a few years. In Asia Pacific, we haven't seen that, right? And I think we really need to ask questions as to why that's the case, and what are the opportunities for us to really push for a mechanism like this. So, regional and global entities like the Global Fund and ASEAN, they can play a really important role in financing and facilitating a mechanism like this. And in fact, the Asian Development Bank are currently exploring a model where credit can be provided to underwrite the financing or the funding for pool procurement of medicines. So we really need to follow up and see how that process goes. Pool procurement can also be conducted through existing third-party platforms. And UNDP, WHO, and UNICEF, we have established these global platforms that you can leverage. But really, this should really be considered only for the short term, because if you want long-term sustainability of a pool procurement mechanism, it should really be country-led and country-owned and country-financed, right? So for any of this to happen, we really need a set of formal agreements and set of formal protocols and governance framework that the participants of this pool procurement mechanism will sign up to. And that includes, again, back to what we were saying before about harmonized regulatory standards and processes. We will need to align in our procurement planning and timelines. And then finally, the legislative and administrative structures also need to be aligned across countries, and that includes some of the licensing and intellectual property issues and barriers that we face with lenacapavir, for instance, which I understand it has a voluntary license for a select group of countries. So if a country that's not part of that group will need to negotiate for voluntary licensing to be able to take part in this pool procurement mechanism. Okay, stop there for now. Thanks.
Thank you, Leslie, for your insightful intervention on regulatory pathways and also to financing approaches that can help keep PrEP affordable and sustainable in Asia and the Pacific. And now let me shift from system and policy to the heart of the implementation communities. And let me go to Tung. Tung, I would like to know how Lighthouse has been leading innovative peer-led PrEP delivery in Vietnam. Thank you.
Thank you very much, and good morning, everyone. I feel so excited because I was here 10 years ago. The macros is still the same size. Myself is not. I'm getting a little bit bigger now. But yeah, to answer your question, I think Dr. Mai already presented very comprehensively about a very different innovations in Vietnam and how community in the centers of everything. So from my perspective, I think the PrEP is not just a medical product, it's not just a service, but PrEP is a kind of comprehensive approach to HIV prevention that involves like community engagement, that involves demand creations and communication education, also service delivery, and also quality improvements and policy as well. So I will go one by one and just summarize a little bit about from the presentations of Dr. Mai. So in terms of community engagement, I think it's really a privilege that community in Vietnam, we have chance to engage with the government since the beginnings of the PrEP implementation in Vietnam. So we engage in develop the national guideline on PrEP. We engage with the PEPFAR Global Fund to discuss about how PrEP should be implemented among the community and how community can engage in those processes. So that is really great process, and I think it also drives to the success of the PrEP implementation in Vietnam. In terms of emancipation, stigma reductions, and educations, like the previous slides also show that in Vietnam we have a lot of innovations. So we have the PrEP Indie tours, so we have a lot of events for the students in universities to really aware about PrEP availabilities and how they can access to PrEP. We also do have PrEP in the industry zone, so we not, ensure that no one left behind. So it means that the people in industry zone also can access to PrEP as well. In Thailand, in Hanoi, and also the other provinces. We also have the campaign, PrEP is self-care. So it means that PrEP is not just only medical product, but it's like the way that you care about yourself, you really care about your personal health, and you're responsible for your health. So that is really powerful message that we deliver to the community, and making sure that they reduce the self-stigma when accessing to the PrEP services. In terms of service delivery, I also love the presentation mentioned about PrEP at community-led clinic, PrEP at the pharmacy as well. We also have the tele-PrEP. Even I know there's still a lot of barriers and gaps in terms of the law and policy to support for that, but that is really great, initiative that we have been taking, and it's also gave us a lot of lessons to scale up maybe in the future for injectable PrEP and also the other kinds of PrEPs as well. In terms of the quality improvement, I think community play a very important role in terms of the community monitoring models and also quality improvement. For example, like Lighthouse has been leading the CPQI model, so it's community provider partnership for quality improvement. So we have the tool, we have the curriculum for the community-based organization to really measure the quality of services, the satisfactions of the clients, and then using the findings and also the insights from the community to inform the quality improvement process for the healthcare facility. So that is brilliant idea and brilliant innovations. And now we scale it up in more than, 5 provinces in Vietnam with more than 30 health facilities in Vietnam as well, and also expanded to Laos, working with TIAS here. In terms of the policy, I think it's really important, Dr. Mai mentioned about coming a very important milestone that we can push the voices of community in our policy for the revisions of the HIV treatment guidelines, the national guidelines, to include the injectable PrEP and also the other new products of PrEP as well, and also how to recognize the roles of the community in the national guidelines, also really important for us to really roll out and also to continue PrEP. Unfortunately, now we no longer have PEPFAR support for PrEP programs, so it is slowed down a little bit. So I'm not sure Vietnam is now the top one or not. But yeah, I think but it's also bring us to the opportunity. For example, we are discussing with Elton John Foundation for like tier co-payment models that is really new models in Vietnam. So we're not left the people behind. So people are not afford for PrEP program, they still can access it with the more affordable options and choices. So I heard the other panelists mention a lot about the choices. So I think that is also one very key ingredient for our success of PrEP program.
Thank you, Tom, for sharing the amazing work that you are leading on in Vietnam. So all the innovations the community are spearheading in terms of community-led service delivery, in terms of campaign, in terms of sensitization and stigma discrimination, but also in terms of policy change to recognize the role of community as service providers, and in terms also of sustainability, considering the difficult financing context you are operating in. I would like now to ask you, here in the room there are different partners, international organization, the government of Vietnam, so I would like to ask you, what do you need from those partners? How do you need them to step up? And is it at the policy level, advocacy, funding, regulatory support? Please go ahead. Thank you.
This is really big questions. Actually. I have a lot of ask to the different stakeholder here, and you are also the key players to scale up PrEP and also HIV prevention and treatment program. Obviously, I think we have no time to have the long list of the key aspects. I just want to emphasize. I think firstly, put community in center and let community lead. I think I just want to remind about that message. It's really important to making sure that community are empowered and engaged meaningfully and ethically in all of the HIV programs. That is really much needed. So we need your role to really recognize that, and also to let government also recognize that as well. I think secondly, for example, UNAIDS and UNDP and WHO, you have a very well-known in terms of the data gatherings and using data to inform the government from the different countries. So I think community data is also really important, given that we have very limited community data. The insight is really rich, right? So how we can strengthen and empower community to gather the data and use the data to inform the government decisions, and making sure that all programs can be relevant and also fit in the community needs. The next ask, I think, is more on flexible and also stable funding. Unfortunately, we have no longer PrEP program, but the Vietnamese government also discussing about how they can use the government funding to fund for portions of PrEP demands for the community. So that is really important. So I think investing in community, empowering community to making sure that they can contribute significantly to the HIV response and PrEP program in the country also really important. And lastly, advocacy. We, like I say, we still have a lot of policy gaps in the different countries. Thanks to Thailand to present beautifully about like a big progress in terms of the policy for PrEP program. Unfortunately, in Vietnam, we still a long road to way to really reach that. So that's why I want to deliver this to Vietnamese government representatives here, but also the other stakeholders, trying to making sure that like the law and policies can support for the program, that can make sure that empower community. For example, like we are talking about in Vietnam right now, we talk about the sustainability roadmap for HIV response. But unfortunately, there are no community system be included. So that's why we can like making sure that community also are sustained and to empower in that HIV response, and also how they can allocate the funding, the government funding to the community-based organization to continue their great work. You mentioned about the social contracting. Is this a way to do that? But I think we also can do more than that, like how we can allocate the funding to the community, making sure that they can use the funding to implement the innovation. So that is some key aspects I want to emphasize in this panel.
Thank you, Tung. I think it's really important to hear what are your needs and to strengthen the importance of collaboration, because really PrEP scale up doesn't depend on only one actor, but it depends on the collaboration of different stakeholders. It requires policy change, as you all mentioned, affordable access, but also mainly community leadership, working with the different actors and all working together. So thank you so much for your reflection, Tung. And now I would like to open the floor for questions. Naomi, would you like to help us? Thank you.
Thank you, Michaela.
Thank
Great
you.
moderation.
Thank you.
Anyone has urgent questions? Okay, let's count.
great.
1, 2, 3. Okay, great.
Okay, thank you. My name is Go from Myanmar. So I would like to introduce my program is Landia organization. Previously we called the top center and from the PSI Population Services International. Now we are like a independent organization, like a Landia organization. We are providing the MS and transgender access worker for the HIV prevention and cancer program. So I have one concern about that. I saw the same presentation in this morning. So we found the same younger age provided the HIV testing, including the breast services in our country situation. The legal age has started from 18. So some of the countries are they started providing like a younger age. So how should we advocate to our government? And I would like to request Dr. Kincho Wintin about do you have any experience or any advice to us, or I would like to get sharing from the other country, like how can we advocate like a youth-friendly service or something like that.
Thank you. Kincho would like to respond.